Hello, my name is Luis Torres. I use he, him pronouns. I'm currently, for my practicum, I'm at the Multicultural Counseling Center. We focus on Latinx patients, so they're underserved and marginalized populations. Typically, a lot of them have been through types of trauma, domestic violence, witnessing domestic violence, and that sort of thing. So we're recently, last month, we had a meeting where we were told that the agency is now going to use what they're calling a trifold model. So at this agency, there's three different divisions. There's family support services, there's skill counseling, and there's the clinical team, which is a therapist. So the family support reaches out to the family. They do like case management services, they do peer support, and so they're really vital. And I think what makes the agency kind of unique. And then there's the skill counseling. What they do is they practice specific skills with patients that the therapists recommend or a family support services recommends as well. They also are now doing, according to the trifold model, they are doing part of the assessments. So the reason that the driving forces for why the agency is pushing this trifold model is one, for availability. So part of the problem is that the wait list is huge, especially because of COVID and all the trauma that people are passing through. So in order to mitigate this, they are trying to make it so each therapist meets with their clients about every other week. And so that there's more availability for patients and for therapists to take on patients. So this is probably a 5. So we're going to go ahead and put a 5 in the driving force and in the availability. Next is to earn more. The more patients you have, the more you're able to charge, especially if you can still charge if it's a skill counselor who's not a licensed therapist, but they're still doing part of the practice, they're still able to make a profit off of it. So that's also a 5. As far as access to all parts of the agency, prior to this trifold model, each of us would just meet with our own divisions. But now that the trifold model is in place, we are in individualized teams. So each team includes a member of each of these divisions. So to be honest, I find it much easier to access and talk to people. And now that I actually know people in the other divisions, so I would probably say this is a 5 as well. I know it seems kind of biased because the driving force is going to have pretty high numbers, but it's just the truth. There's a reason why they implemented it. As far as resisting forces, there's some pushback from employees because it's confusing. I probably put this as, I don't know, a 2, to be honest, because once they're more familiar with it, I think that there'll be far less resistance. And there already has been less resistance since it's been implemented a month ago. The scheduling complications. So this is rough because it goes from therapist to skill counselor to therapist for a new patient, and that can be a real hassle for them. So as far as scheduling complications, I would say that this probably is a 4, and it's not really like clean. It's a little bit of an issue right now for patients and for therapists because sometimes, which this leads into the next one, is there's a lack of skill counselors. Like there's not enough people to really be able to implement it smoothly. But I would put that probably as a 3 because once they hire more skill counselors, it'll be less of an issue, even though they only want us to use the skill counselors that are assigned to our team. But right now they're amending that, so that kind of helps that. So as far as what they call in the video, the sort of like the knot in the middle, I'm going to go ahead and place those. And as you can tell, most of them are going to be on the driving force side, which is kind of what we expected, right? Not perfectly in the middle, but about. So this is a change that the agency did for a reason. Obviously, they knew that there's going to be some conflict. For example, in the text by Rishi, they talk about the reason why implementations are made. And it was because they needed to make more profit and also because the waitlist was very huge. So this was sort of their innovation, and also was they were able to fix the majority of the problems. As far as the resisting forces, I would say that for the most part, that they will go away with time. The one thing that I didn't mention though is that eventually they're going to need more space because it's hard for all the therapists to be able to utilize the current building. They can't all be there at the same time or else there'd be no space. I look forward to hearing your comments and your questions. So thank you so much for listening.